And now I would like to welcome our next presenter, who is Katharina Wirnitzer from Austria. And she will be speaking about the power of lifestyle medicine, starting with the dual approach to health from sustainable diets linked to PA, sports and exercise as minimum recommendation at schools and universities for better future public health. Please welcome. Thank you.
Thank you very much. Welcome to the closing session of this morning. So it's the closing session. I take about 20 minutes, so ignore, please, the gong. But feel free to leave if you want for lunch or stay seated. So, the power of lifestyle, brackets open, medicine, it's an integrated concept you all know to connect together 6 different lifestyle areas. So we don't have enough time to dive into all of them, but I would like to construct with you today a dual approach of healthy eating, active living as a minimum recommendation to start. I do not say it's the end point, but it's how to start. So, and I will kindly refer you to the first studies. There is a convincing body of evidence for physical exercise and sports, tracing back to the first study in 1952 on UK bus conductors about chronic diseases and mortality, and also about vegetarian vegan eating, the thrilling Adventist health study first launched in or published in 1978. So please kindly dive into this extraordinary body of science. Fasten your seatbelts now, I will challenge you a bit, and let's go. So, we are addressing the motto of this Congress, what unites us, and let's see what at the end we can take home for heritage and what we can do. So there is huge potential for each of us. It's about to take action. We do not know all from science, but we know enough to start. And for me, the translation of science into practical fields and apply what we already have is the lack we already have to focus on. So what is the background of today's talk? My students often say, why don't we know about all that? So my question back is, are you a sleeping beauty of Walt Disney movies, or are you still awake? It's your choice to shake yourself up and stay awake in these times of when we remember COVID. Something was hidden from us. And well, we are living in times in the 21st century of a big health paradox. On the one hand, we have high-tech medicine. At the other side, we have millions of numbers of people suffering from chronic health conditions. And while health is a natural state from birth, it has to be earned over a lifetime. And it was first mentioned in the 16th century that there might be, other than genetic factors, lifestyle modifications that bring us to healthy longevity. So it's all not new, it's more an ancient wisdom. So I guess we agree that health is a major topic for human development, and that's why it's in the agenda of all the big organizations. And an inherited habit of young children tracks over time into old age, and this is our way to go. We have to cure adult and elderly, but we have to start much earlier if we want to shape future health and better health. And that's why it's so relevant for the educational settings, from kindergarten up to university. And there we have to start after me. So, it's still unenthusiastic what 2 global scaling health problems we have. Still, we have the physical inactivity crisis unsolved, and also overweight, obesity from a public health perspective. And also in COVID, we all know it worsened the situation, and clearly we have numbers that out of 3 kids, 2 fail to eat enough healthy foods. Fruits, vegetables, grains, legumes, for example, and also 4 in 5 are insufficiently or non-active. So this is a mess. And we know that according to the WHO, we have massive numbers of non-communicable diseases when we look at the mortality reports. And the good news is, in this bad situation, most of it is preventable and reversible by lifestyle changes. So, and we know already in the top 5 risk factors we have, the solution is already delivered, but we have to focus on that. It's being active and eat healthy foods. We know from the global burden of disease that 1 in 5 in the Western European countries dies or is dying because of poor and unhealthy habits. So, and this is not because of crazy Katharina here on the podium, it's evidence. You can read all the reports, and it's well accepted in the scientific community. So what is all about, who is responsible for your own health? It's me. I am the most effective person for my own health status. And the medical care system, the public health system, as we heard frequently today, has the least impact on my personal health. So it's about my conscious decisions and actions and will to change. So from individual health, now, in 10 or 20 years, we can shape better future public health. We have to do this. So, and I would challenge you, is it fact or fiction to get healthy old age? So centenarian, supercentenarian. You all know the blue zones. We had it in our first talk today. And we can learn a lesson from them. So we know that the most basic principle is not limited to, but the most basic principles are two. The dual approach to health. It's clearly not vegetarian, but it's 9.5 portions, if it exists, out of 10 from plants. And it's daily moderate activity. However, when we look at the blue zones, even Okinawan elderly diet outperforms all the other dietary and lifestyle habits from the other blue zones. And I will challenge you again, what if the Okinawan elderly diet is not the upper boundary? What if there is still potential to be tapped by, let's say, a whole food vegan diet? So maybe there is even more, not to get a healthy centenarian, but to get a super centenarian. So what is behind all that? Very natural already in our daily life, there is the dual approach prevalent. So exercise is medicine and food is medicine. It's an ancient wisdom. What are you doing when you first get up in the morning? Today, you move to the bathroom, I guess, and from the bathroom to the dining hall for breakfast, or at home to the kitchen. And from then you move to a job, to school, by foot, by public transport, by bicycle, whatever. So it's already there. Why don't we pick it up and put it into action? So I would like to just add this together for a super formula, and to test the super formula if it's really fact or fiction. So the super medicine exists. It's not the $1 million pill. That does not exist. We have to earn all that. And for the educational setting, it's perfect. Why? It's so natural in our lifestyles already. It's easy, it's cheap, it's effective, and it's cost-effective too. So why don't we go for that? So I think you agree that when we put exercise and physical activity on the track for health intervention, it works. And if we put healthy diet on the track as a health intervention, it works too. But what if we combine it? Isn't that 1 + 1 is more than 2? I guess this is. So there are tremendous health benefits from this cumulative benefits that we have to tap. So just a short review to the COVID-19 pandemic. We heard from Italy. The recommendation was there from the WHO, but what about the media? They didn't deliver that recommendation, that the dual approach was already in their recommendation. No one told us about. And also, just 2 major reports I want to share with you. From healthy foods and high quality, we have seen that the immune function was better, the risk for infection was less, and also the severe outcomes was less. And also from physical activity, if you reach the recommended level, the health condition in COVID times were much better. And the people are ready for such modifications. They are willing to move towards healthier lifestyles. And the policymakers just have to address it, to encourage the people and set up the policies. So let's very shortly dive into the vegan diet. We know that the benefits excel the risks by far, and from the position statements we have, the latest ones, when appropriately planned, it's healthful and nutritionally adequate, and it is appropriate through all the life cycle stages, meaning from pregnancy to the elderly, and also this means in childhood, adolescence, and for athletes, people like me. So this is the way to go, and when we look to the literature, thanks to the TCIM, they did it for us, the whole food vegan diet could be considered as the most healthy diet we have. Why is this? When we look to the literature, the more you cut out animal products from your plate, the healthier your diet gets and the more health benefits you achieve. So, question. Okay, Katharina, I eat tons of veggies. Can I compensate for the negative effects? Well, there are tiny little studies, also not in the media prevalent, but there is a nice study showed us even if you eat the maximum amounts you can tolerate of fruits and veggies, you're not able to compensate for the negative effects. Regrettably not, or hopefully not. It's up to you how to interpret that. And one of these negative effects also is not known by the public. Even most physicians I talk to do not know this report, and it's 7 or 8 years old. It's thrilling to me. So, we know that meat, especially processed meat, is categorized as cancerogenic, and this is the same category as smoking tobacco, asbestos, and also plutonium. And I guess you agree that these substances are lethal. Why don't we accept that meat was classified? It's a major report. And well, so you say to me, okay, let's cut down to the minimum amount. Well, 1 or 2 slices of ham, from this literature we know this, increases several types of cancer. So we cannot control the risk even if we eat tons of healthy food items. So, what about sports? Sports is considered medicine, we know this. And a healthy human will bring a successful athlete. And when an athlete is not ill and suffers from sick leave and illness-related interruptions, we can conduct our training schedule and go for peak performance. So being healthy is the prerequisite for being a peak performer, not only in sports, also in job, as a family mother and head of a family. We need to be successful as multipliers. And we agree in science that there were so many benefits from being active, not only in mood, on stabilizing body weight and maintain a healthy body weight, but also on cardiovascular system, respiratory system, bone health, metabolism, digestive function, organ function, whatever. So many benefits I can list. So we all know when we're active a lifetime, we could perform good when we're getting older. There is also a nice study proving this. 75-year-olds who were active a lifetime were shown to have the cardiovascular health and fitness of 25-year-old sedentary people. Isn't this great? To me, this is thrilling. So the peers do not perform nearly similar to this. So there is a general knowledge also that the lower the resting heart rate of an athlete, the better the fitness is. So it's a good indicator, resting heart rate, for fitness level. But what most physicians do not really consider, I hope they know, is that resting heart rate is a risk factor for premature mortality. So you die earlier if your heart rate in resting state is higher than 60 to 70 beats per minute. And well, if you can control this for 60 beats per minute or less a lifetime, just for doing nothing else, you can live longer and healthy and happy with your family at least 10 years. And there is a tiny little study I want to share with you. You have 2 ways to achieve this. Going for sweaty sports, which crazy people like me like, but you can do also gardening a lifetime, or you can just be a vegan couch potato. So there is a nice study on legumes and pulses. It showed us a result. When you eat over the course of the day a cup of beans and trace this for a whole year, your heart rate drops after 12 months like 10 beats per minute. And this is the same amount we can going for marathon exercise every day. So, and now what we combine these two, eating much healthier, vegetarian or in the direction vegan, and being active. Wow. So, and just in short, this is my topic in research, it works in performance sports too. So they profit as professional athletes from all these cumulative benefits. So and again, you insist and say, well, we was told all our lifetime it's our holy duty to eat meat to survive. Well, but data show that also in the prehistoric times there were Neanderthal populations. They only eat pine nuts, moose, and veggies or plants. Like the gladiators had a very specific diet, nearly no animal protein, or the least they can. It was very special, so they could survive in the arena. So it's a myth that's kept alive, and there is no fact on that. So please, I kindly refer to a part of our works. So the kids are the future of our planet, and so I'm happy to work with them. We have the veggie boom being unbroken since the year 2016, and the young people are the main drivers of that. Now we have in the German-speaking Central European countries between 10 and 14%. We look to India with about 40%, I guess, vegetarians, so this would be the way to go. But why is this that the young are such massive key drivers? They have a deep and strong desire to move towards more sustainable lifestyles, to save the planet very easily. And this is diet included. And we have all these reports since the year 2006, starting with the FAO report, showing us that meat is not the way ahead, or animal products. And just to give you a picture, it's not to read. Please do not read. In there we have exploitation of resources and injustice of the distribution. We have pollution of the environment, of water, damage of the forests. We have a threat from infectious diseases, non-communicable diseases. We have the climate change, and much more, like also biodiversity loss, all from animal products. And it's written black over white in the 2022 EPCC report that the greatest shift potential identified by scientific data is the step towards plant-based diets. And well, when we look at the World Overshoot Day, our resources, Czech Republic and Austria has something in common. We exhausted our resources, our annual resources, already in April. So we are starving now, because we have nothing left. So this is in expense. And also the One Health concept of the WHO will not work further in the future if we do not acknowledge that meat is not the way to the future. We have to cut out intensive livestock farming and rethink what we can do from that to gain the maximum benefit in all the three sectors, also of the WHO concept. So, and the kids, what about the kids? Again, it's inherited habits that track over time. So making a healthy kid will trace to a healthy adult. And a healthy adult can be very successful in job, as a therapist, as a doctor, as a teacher, as a lecturer, whatever, being a successful role model and multiplier. And this would be the way to go. Luckily in Austria, and I promise in all of your countries you have such things, we have it written down in the school curricula, in the overarching educational goal. As a teaching principle, this means it is relevant to all compulsory subjects. Every teacher of every compulsory subject, whether it's mathematics or English or whatever it is, shall address in the lessons health promotion, health education. Most teachers don't know. So this is the gap in the university education. We have to implement this and to overcome this gap. So, and luckily, we, the sports guys, have the most resources from the curriculum. We can perform best in here, but this must change for all the subjects. So as you can see, we're publishing a lot. One report we are now publishing with the Harvard Medical School too. So this is my topic, as you can see. That's why, short introduction in two major studies of mine from Austria, the Austrian Nationwide School Study and the Austrian Nationwide University Study. So at the end of a big population basic sample, we gained a representative sample of 1.1 for the secondary pupils and 1.6 for the tertiary students. So mainly female, and the good news, 3 in 4 of both populations have a healthy body weight. So when we look now at the independent variable of dietary type or diet type, we see still in both populations we have the majority mixed eaters, but it's getting better. The vegetarian and vegan groups are increasing. So, and when we look at this data, they're mostly the youngest, And mostly they have significant difference as they have the least body weight, are the leanest, and also for body mass index, it's calculated best. And if you look here, there's the pointer. We have the biggest fraction of healthy body weight in the vegan group. So a lot of significant results we have here. And this translates to other areas of health behavior. And now this is my point. We can see a significant increase the healthier you eat, the more you're active. On a weekly basis, the number of days per week, and also the fraction in your leisure time activities. So it's a significant increase. That's a good news. And also alcohol consumption is significantly best in the vegans. I just need 3 minutes more. Please.
3 minutes is okay.
Okay, thank you. So what we did not found is a difference in smoking habits. But all the other health behaviors are linked to diet. So this means, at the end, just in short, giving you the overview, because all the studies are open access. Just go to the internet and download this. The numbers of vegetarians are growing, and with their better dietary behavior, there is much more they bring with them. And hopefully in 10 or 15 years, we can shape better public health from that on a large scale if we join our forces. So how to transfer, that's why I'm coming to the end. It's prevention first. We do need to treat patients at the old age or adulthood, but we have to focus massively to the youngs. So meaning kindergarten, curricula, kindergarten lessons, primary school, secondary school, and closing the gap at the universities. Teachers, medical schools need introductory lectures. But at the same time, we do not have to wait. Now we have to check and reflect if the offer at the buffet, if the canteen, if the sports and exercise offers at the universities and school are sufficient and stimulate enough to adopt healthy habits. On a personal level, it could be such a picture. However, there are a lot of behavior change models we're focusing on in our works. It's just that big picture. And on the public health level or governmental level, we refer to, this is an adapted graphic from the social health determinants, so it's not new, but as you can see, the individual must be in the center, and the micro unit is the individual plus its family. And clearly, you know, every individual, we are part of communities, family, classes, working groups, whatever. It traces up to the governmental level, where they make the policies, they are the decision makers, and back, they educate the doctors, the primary and family care physicians, the therapists, you. So this is the gap we have to close, that those guys has introductory lectures on the power of lifestyle, the power of lifestyle medicine. Usually a doctor knows nothing about exercise as medicine and why. Food is medicine and why, which foods? So this is the way to go. So now to close the gap and take home. It's a fact that it works, the dual approach to health. It's not fiction. So it works and should be recommended to all these practical people out there for the settings. And I identified only 2 years ago with the help of Maran Tangavelu, he's over there, helped me, that this holistic concept already includes in Ayurveda and yoga the ahimsa, which means vegan diet shall be evident in the yoga and Ayurveda practice, but it's not. 96% are not eating vegetarian or vegan. It should be the other way around, after me, to fulfill what is in this wonderful, unique principle of ancient health. So, sustainable health as a starting point. When you knock the door of a headmaster and say, well, we have to integrate the lifestyle area of more sleep to every lesson, he tells you, Katharina, you're crazy, please leave my office. But when you say, knock, knock, dual approach, it's eating and exercising, please come in, take a seat, let's talk about that. That's why my point is, this is the start and not the end. So I kindly refer you to taking over the responsibility and follow the role model of Martin Luther King, Greta Thunberg, and also Mahatma Gandhi. Be the change. Thank you very much. There are 2 more lectures of my PhD students this afternoon and also tomorrow a poster. thank you very much. Sending you to lunch or to the next announcement.
Thank you, Mrs. Wirnitzer, for your contribution on how healthy lifestyle creates a healthy planet and the importance of the education